How to assess forearm tendinitis. Your forearm extends from the elbow to the wrist. In each of the joints above and below the forearm are tendons that help these joints move and keep your bones and muscles functioning. When you suffer from forearm tendinitis, you have inflammation in the tendons that connect your elbow to your forearm and wrist. If you suspect that you have forearm tendinitis, then you will need to see a doctor for diagnosis and treatment, but you can begin to assess forearm tendinitis as soon as you start to notice pain or discomfort in your forearm. Method 1. Checking for symptoms. 1. Check for symptoms of forearm tendinitis. You can feel pain from tendinitis in the forearm around the tendons that connect to the bone near your elbow. Some of the common names for forearm tendinitis are tennis elbow and golfer's elbow. You may have forearm tendinitis if you experience any of the following symptoms: mild swelling in the area, tenderness with use and when pressing on the tendon, pain that is often described as a dull ache, pain that occurs more often when moving the affected limb. 2. Consider whether you may have golfer's elbow. The medical term for golfer's elbow is medial epicondylitis. The pain associated with golfer's elbow is on the inside of the elbow due to inflammation in the flexor muscles, the muscles that allow your elbow to bend. Placing too much stress on these tendons through repetitive motions will increase your risk of developing this condition. Symptoms of golfer's elbow include pain starting at the elbow and radiating out to the lower part of the arm, stiffness in your arm, increased pain when you bend and flex your wrist, pain that is aggravated by certain motions, such as opening jars and shaking hands. 3. Determine if you have tennis elbow. Tennis elbow, or lateral epicondylitis, is located on the outer portion of the elbow. The pain starts from repetitive movement which involves the extensor muscles, or those which work to straighten the elbow. The symptoms of tennis elbow often start with mild discomfort and then graduate to more significant pain over months. There is often no injury or specific incident to which you can attribute the start of the pain. Common symptoms of tennis elbow include pain or burning on the outer part of your elbow and down your forearm, a weakened grip, worsening of symptoms when you overuse the associated muscles, such as by playing racket sports, turning a wrench, or shaking hands. Method 2. Considering causes of forearm tendinitis. 1. Think about whether you are having symptoms in one or both arms. With any kind of forearm tendinitis, it is more common for your dominant hand to be affected, but both arms may be affected. Tendinitis will occur in the tendons against which you consistently exert the most force. Tendinitis may also occur in the tendons that control either extension or flexion, straightening or bending, but it rarely occurs in both at the same time. The repetitive motion that exerts the most stress, either force against flexion or against extension, will cause tendinitis. 2. Identify repetitive movements that may have contributed to your tennis elbow. Tennis elbow may develop if you exert force against an object with your elbow extended. Although tennis elbow is often caused by playing tennis, using a lighter racket and a two-handed backhand swing may reduce your chances of developing this condition. Some other types of movement that may also cause tennis elbow include repetitive heavy lifting or using heavy tools, jobs that involve the use of squeezing and twisting movements or precision motions, new or uncommon movements such as gardening for the first time in the spring, lifting a new baby, or packing and moving your home. 3. Consider activities that may have contributed to your golfer's elbow. Although named after the sport of golf, golfer's elbow can also be caused by other sports that involve gripping and/or throwing motions, such as baseball, football, archery, or javelin throwing. Some other types of movement that may cause golfer's elbow include doing jobs that involve repetitive motion of the elbow, including computer use, gardening, chopping, or painting. Using vibrating tools. Using a racket that is too small or heavy for your ability, or putting excessive topspin on the ball. Participating in other repetitive activities for an hour or more on consecutive days, such as weightlifting, cooking, hammering, raking, or chopping wood. Method 3. Treating forearm tendinitis. 1. Get treated right away. Although it is not life-threatening, forearm tendinitis can restrict your movement and activities for weeks or months because of pain and discomfort. Without treatment, tendinitis will also increase your risk of suffering from a tendon rupture. This is a more serious condition that requires surgical repair to restore function to the tendon. If tendinitis persists for several months, you can experience tendinosis, which has a negative effect on the tendon and causes abnormal new blood vessel growth. Long-term complications of tennis elbow can result in recurrence of the injury, rupture of the tendon, and failure to heal with either non-surgical or surgical repair due to a nerve entrapment in the forearm. Long-term complications for chronic golfer's elbow can lead to chronic pain, limited range of motion, and a lasting or fixed contracture, bend, in the elbow. 2. Schedule an appointment with your doctor. If you suspect that you have tendinitis, make an appointment with your doctor for evaluation and treatment. Early diagnosis and treatment will lead to more successful outcomes for your forearm tendinitis. To diagnose your forearm tendinitis, your physician will take a thorough health history and perform a full physical assessment. Your physician may order X-rays if you were injured before the pain started. 3. Discuss treatment options with your doctor. Following diagnosis, your doctor will recommend treatment to reduce your pain and improve your arm movement. Make sure that you follow your physician's instructions for treating your forearm and ask any questions that you have about the treatment. Your physician may prescribe an anti-inflammatory medication to help reduce the inflammation in your forearm, reduce pain, and improve arm function. You may need to wear a brace to support the area and reduce any stress on the muscles and tendons. This brace may immobilize the area or just provide support, depending upon the severity of your condition. Your doctor may inject corticosteroids around the tendon to reduce inflammation and pain. However, if the condition lasts more than 3 months, repeated injections may weaken the tendon and increase the risk of tendon rupture. 4. Ask your doctor about plasma therapy. Platelet-rich plasma therapy treatments involve taking your blood, spinning it to separate the platelets, and re-injecting those platelets into the tendon area. Although this treatment is still being researched, it has been beneficial in the treatment of some chronic tendon conditions. Talk to your doctor to find out if this treatment is a good option for you. 5. Find out about physical therapy. Your physician may recommend physical therapy in conjunction with other treatments for your tendinitis. In physical therapy, you will learn how to do forearm stretches designed to reduce any tightness in your muscles. Knowing how to reduce this tightness is important because it contributes to the micro-tearing associated with tendinitis. Occupations and recreational activities that require a lot of gripping, force placed against extensor or flexor muscles, or repetitive hand or wrist motions can develop tight muscles that contribute to tendinitis. Your physical therapist may recommend deep friction massage to trigger the release of natural stimulants that may help to heal the tendon. This technique is safe, gentle, and easy to learn from your therapist. 6. Watch for severe symptoms. In some cases, tendinitis may require emergency medical treatment. Learn what the severe symptoms are so that you will know when to get help right away. Seek immediate medical attention if your elbow is hot and inflamed and you have a fever. You can't bend your elbow. Your elbow appears to be deformed. You suspect you may have cracked or broken a bone from a specific injury to the area. 7. Support your recovery with home remedies. Although you should see your doctor for a diagnosis and treatment of your tendinitis, there are some home remedies that may help to alleviate minor pain from tendinitis. Ask your doctor if these remedies are appropriate for your situation. You may be able to relieve some of your tendinitis pain by resting the inflamed joint and stopping the activity that triggered it. Icing the joint with a towel, wrapped ice pack 3 to 4 times per day for 10 minutes at a time. Using over-the-counter anti-inflammatory medications, such as naproxen, Aleve, or ibuprofen, Motrin. Tips. If you cannot get in to see your doctor right away, ask about what you can do to ease the pain until your appointment. Your doctor may advise you to rest, ice your arm with a towel-wrapped ice pack, and elevate the joint to help reduce the swelling. Warnings. Be aware that there are some serious risks associated with steroid injections. Steroid injections will often reduce the pain and discomfort, so you may feel capable of using the joint more. However, this continued use of the damaged joint may lead to further damage and rupture. Tendon rupture is accompanied by severe pain, weakness, bruising, inability to use the joint and, in some cases, a deformity of the joint.